Hello, Robert Bastian here of Laryngopedia and Bastian Voice Institute. This is a simple little video in which I just want to make an analogy to voice use and spending money. This is especially appropriate for people who have vocal cord injury or who are prone to vocal cord injury. Usually they are overdoers, they are vocal overspenders. And so they get injuries such as nodules, polyps, a bruise, that kind of thing. And so when we talk to them about how to rehabilitate after vocal cord injury, we talk about reducing the amount, the manner, and the spacing of their voice use. So you can think by analogy of the amount of vocal money you're spending, the manner. Are you spending it in large amounts quickly, or are you doling it out little by little? And spacing is similar, the idea that if you have a very, very busy morning, loud talking on a street corner or whatever, then maybe you have lunch alone in a quiet place by yourself. So the amount of voice use, keep in mind that every second that you're producing voice, you are vibrating the vocal cords. They're made for it. They're tough. You can make very loud and continuous sound if you do it well, but there's a limit. You just can't keep spending your vocal money without becoming short of funds and even in deficit. So if you have nodules, polyps, vocal cord hemorrhage, that kind of a thing, then you reduce the amount, the total amount of vocal money you spend. Think of it as the total number of minutes, seconds, hours that your voice is producing sound. That's the totality for a day, but it's the manner of voice use. If I use my voice gently like this, as compared to quite loudly, competing with background noise, for example, the manner of voice use, the way it's being used, can have a very big impact on the propensity to injury. So you're trying to make your voice use gentler, a little more reading to children, a little more talking to people you can reach out and touch, that kind of thing. And then the spacing is, again, you think about that total money needs to last the full day, and so you don't want to spend it all in the morning. So some people actually build periods of time when they're not using their voice throughout the day. Now, if one is injured, there are rare circumstances where you don't want to spend any money for a few days, but it's rarely more than a day or two. And then the idea is just to economize, spend less money than is your habit. Can be a little bit frustrating, but you live for a period of time in a frugal kind of use of voice, spending less vocal money, amount, manner, and spacing, and then you give it some weeks or months to see if your injury can resolve. So there's my little analogy, the amount, manner, and spacing of voice use, the amount, manner, and spacing of spending your vocal money. And by the way, you can use the vocal cord swelling checks that is in a previous video to monitor your progress. Now, you can begin, if you're injured, you can begin on your own with this concept of sort of spending less vocal money. But of course, significant or chronic injury, you will do much better under the supervision of a voice qualified speech pathologist, a speech pathologist who is interested and experienced with voice disorders and specifically vocal cord injuries. So there's the concept of how to begin the process of rehabilitating vocal injury, and I hope that helps. Thanks for listening.